Do you practice implantology? Are you scared of failures in implantology? If that is the condition, then this is the video perfectly made for you. Hi friends, this is Dr. Kunal Banka, and today I'm going to talk about how to eliminate and reduce failures in implant practice. Now there are a lot of factors, right from patient selection to implant selection to procedures. Now I'll start with the implant selection. Whatever implant you select, it should have a good surface. Now what do I mean by a good surface? The surface of the implant should align with your treatment goals. If you're placing an if you're placing an immediate implant, the surface should be active. It should be able to engage the walls of the socket. If you're placing a delayed, you don't need a lot of torque, then it should be a passive implant. Or it may be tissue level implants. If there's a vertical height is less, you can use a tissue level implant. There are a lot of variations, so choose your implant very wisely. Don't choose your implant based on marketing. मार्केटिंग वाले आकर के बहुत चीज़ें बोलेंगे, सर ये इम्प्लांट बेस्ट है, इससे बढ़िया इम्प्लांट तो आज तक हुआ ही नहीं. बट आप वो खरीदिए जो साइंस कहता है, आप वो खरीदिए जो आपको ज़रूरत है. आप ऐसा कुछ भी मत खरीदिए जो कि मार्केटिंग वाले बेचना चाह रहे हैं. बाय व्हाट वर्क्स, डोंट बाय व्हाट सेल्स. ओके. उसके बाद जब हम पेशेंट सिलेक्शन करते हैं, हमारा पेशेंट सिलेक्शन कई बार फॉल्टी हो जाता है बिकॉज जब इम्प्लांट के पेशेंट आते हैं और हम बहुत एक्साइटेड हो जाते हैं कि आज हमको इम्प्लांट करने का मौका मिल रहा है, और हम बहुत सारी चीज़ों को इग्नोर कर देते हैं, जैसे पेशेंट का एक्सपेक्टेशंस ऑफ द पेशेंट्स, द स्माइल प्रोफाइल ऑफ द पेशेंट इफ इट्स एन एंटीरियर केस, द बोन प्रोफाइल. दिस द मोस्ट ऑफन ओवरलुक्ड एस्पेक्ट ऑफ एन इम्प्लांट पेशेंट. हम इम्प्लांट कमिट करने के पहले पेशेंट का बोन चेक नहीं करते ऑन CBCT or anything. We just do a clinical examination and we commit the patient. Mostly in the maxillary 6 regions. That is where we suffer a lot of difficulties, because when we see intraorally we see a wide ridge and we assume that there's going to be a good bone height, but when we do a CBCT or an OPG, we see that bone height is missing, totally missing. So be careful guys, be careful about that. And then soft tissue, you have to look at a soft tissue. If the patient has thin phenotype or a thick phenotype, based on that you can decide on your grafting, because grafting is not always done when there is a deficient wall. It is also done when you expand the ridge using a denture burr, or you do a ridge split, or when there's a thin phenotype, then you might like to do some soft tissue grafts, because soft tissue is equally important as the hard tissue. Clinicians all over the world are coming at peace with the fact that soft tissue is very, very important in the durability of implant. It contributes to the durability of the implant in a big way. It's as important as your hard tissue. So guys, before you take up a case, always evaluate what type of graft is needed or not. Don't think on financial or economical lines whether the patient can pay or not. First you think about the science, and then we'll go to the economical part, whatever is possible, whatever is not possible. Once you decide all that, you have to discuss it with the patient. So and so is the treatment protocol. In your mouth, this is required. Graft is also required, and this will cost you such and such amount. This you have to talk to the patient openly. Don't think that patient will run away if you're talking about the cost. If the result is not good, patient is going to run away anyways. But if you tell the patient everything, and if the patient agrees and you give a very good result, patient is going to be yours forever, और वो आपके पास 10 और लेकर के आएगा. लेकिन अगर आपने पेशेंट को सारी चीजें नहीं बताई हैं और बाद में कुछ गड़बड़ हो जाती है, इम्प्लांट फेल हो जाता है, पेशेंट सबसे पहली चीज यही बोलेगा, डॉक्टर आपने बताया क्यों नहीं, मैं तो तैयार था इस प्रोसीजर के लिए, आप जो बोलते हैं मैं कर रहा हूं, आपको बताना चाहिए था. एंड दैट्स वेयर वी बिकम रॉन्ग, दैट्स वेयर वी आर एथिकली रॉन्ग. सो transparency with the patient is very, very important when we are planning a treatment. We have to share everything with the patient. Otherwise, there might be friction between us and the patient in case of any unforeseen events. Another point, if you really want to reduce failures in your implant practice, You have to focus on asepsis. आपका ओटी बहुत बढ़िया स्टेरलाइज होना चाहिए, इस लेवल पे स्टेरलाइजेशन होना चाहिए जैसे आप अभी एक कार्डियक सर्जरी करें तो पेशेंट को कोई इन्फेक्शन ना हो। आपके इम्प्लांट में भी हर एक सरफेस वैसे ही स्टेरलाइज होना चाहिए। योर सरफेसेस व्हाट यू टच, द एयर, द फ्लोर, everything should be sterilized very well, and you should be wearing proper protective equipment along with the patient who is covered in the proper protective clothing. That is very, very important. And the last point, what is important for the success of an implant? We've done a very good implant. Let me say, for example, a very good full mouth case. Amazing result. We are very happy. But we forget to give the post-op instructions. Most important ones. You know what are the most important post-op instructions in case of an implant? Number 1, regular checkup and follow-up. Initially, process is delivery के बाद, we call the patient after 2 weeks, then we call the patient after 3 months, then we call the patient after 6 months, and then annual checkups. This is the first post-op instruction you need to give to the patient. Second, one scaling every year after implant placement is mandatory. Otherwise, you should not be responsible for the failure of the implant. You have to take this undertaking in return from the patient after every implant process is delivery. Hygiene is very important for the long-term success of an implant. Another thing you have to tell the patient, brushing twice a day along with the use of a water floss is compulsory. And the last point, don't forget to give a night guard. Evaluate the bite of the patient and give a night guard if required. The patient is a bruxer or a very thick masseter, or patient has clenching habits, and even if they don't have it, try and give a night guard in every case, because that saves lot of trouble later for the patient and for you, and increases the longevity of the implants. So these are the above are the few points which, if you listen to it, if you memorize them, and if you use them in your practice, they're going to reduce and minimize the implant failures, and you can practice implants stress-free. So guys, I'll see you in another video with another topic on another day. Goodbye till then.